All right, let's get started. Medicare 101. All right, so what is Medicare? Medicare is a federal health insurance program for people who are 65 or older, certain individuals who are younger with disabilities, people with end-stage renal disease, which end-stage renal disease is basically kidney failure requiring dialysis or transplants. Most times it's called ESRD. So let's talk about what Medicare A and B are. So there's A, B, C, and D. I'm going to start with A and B. So Medicare Part A represents the inpatient hospital care, inpatient mental health, skilled nursing facility care, home health, and some blood transfusions during inpatient care. Part B is basically everything else. So everything outside of an inpatient hospitalization falls under Part B. So you have your surgeries, your doctor visits, preventive care, lab services, home health care, outpatient physical therapy, durable medical equipment, outpatient mental health, and ambulance. So, does original Medicare cost anything? So, Medicare Part A is typically at no cost to most individuals as long as you've worked for at least 10 years or 40 quarters. But if you have worked for less than 10 years, it would be $285 per month, or if you or your spouse worked between seven and a half and 10 years. And if you or your spouse worked fewer than 7.5 years, you would be paying $518 per month for Medicare Part A. Now, these are 2025 numbers. As soon as the 2026 numbers come out, I will let you know. So Part B. Part B does have a cost. It typically goes according to your adjusted household gross income from 2 years prior. Medicare out-of-pocket costs under Part A. So hospitalization. The reason why people get additional coverage outside of Medicare itself is because Medicare does provide you with medical coverage, but it doesn't cover you 100%. So, for instance, under Part A, if you go into the hospital and you have an inpatient hospitalization, meaning you stay overnight, the first $1,676 is your deductible that you would be paying for that hospital stay. Now, if you stay in the hospital for more than 60 days, once you hit the 61st day, you're going to be paying $419 per day all the way up to day 90. After that, it's $838 per lifetime reserve day after day 90 of each benefit period. A benefit period basically means if you are in the hospital for a consecutive amount of time, you're not discharged, you are in there consistently, that's a benefit period. If you come out of the hospital and then go back into the hospital, even if it's for the same thing, your deductibles and everything resets itself. So your benefit period is the period of time where you are consistently in the hospital without being discharged for that time frame. Skilled nursing facility, the first 20 days is zero per benefit period. After that 20th day, it's $209.50 per day from day 21 to 100. Once you hit 101, all costs for that day are yours 100%. And the reason people get secondary insurance for Medicare is for this picture right here. So just imagine you have surgery and you have this really big bill. Depending on how long you're in the hospital, your bill could be pretty high. A lot of times people will get additional coverages to cover these parts. So Medicare out-of-pocket costs under Part B. So the service of medical expenses, outpatient, doctor visits, specialist visits, Medicare pays 80%. You're responsible for 20% of the approved amount after a $257 deductible. That $257 deductible is per calendar year. That is the number that changes every year. So the 80% and that 20%, that never changes from one year to the next. But that Medicare Part B deductible of $257, that does change every year, and it usually changes in January of each year. So when I was talking about the cost of Medicare Part B earlier, I was referring to this lovely chart here. So if you are an individual and your income is $106,000 or less, your Part B premium is going to be 185. If you're doing a joint tax return and your income is less than $212,000, you also are at 185. If you're married and you're doing a separate tax return and you're at $106,000 or less, you too are at 185 a month. And this is per person. Now, these are 2025 numbers, so they're going to be looking at your 2023 income tax adjusted amount. Now, you're not providing any information to Social Security, and it is Social Security that enrolls you into Medicare. And it's also Social Security that determines what your Medicare Part B premiums are going to be. You do not need to provide any information to Social Security. Social Security is going to have a conversation directly with the IRS. So what's going to happen is you apply for Medicare, and then Social Security is going to send you a letter and say, hey, we had a conversation with the IRS, and we see in 2023, this was your adjusted household gross income. So this is what your Part B premium is going to be. So you have a scale from 106,000 all the way up to 500,000. So as you can see, Medicare can cost you anywhere from $185 a month all the way up to $628.90 per month. Now, this column here, this is the IRMA column. So what that basically means is if your income is higher, you're going to pay a surcharge for having a Medicare Part D, which Part D, the easiest way to remember is Part D is for drugs. If you have a Medicare Part D drug plan, they're going to charge you this, whatever's in this column. This is what's going to be charged to you as I refer to it as a surcharge, because if your income falls in this first line, you don't get a surcharge. But if your income is any higher, they're going to add you're going to have the Part B premium, and then you're going to have the surcharge Part D, which is going to give you the monthly total in this example, $272.70. So you have to see, where does your income fall over here? And then you look all the way to the right and it tells you what your premium is going to be. And again, this is always per person. Yes, as your income changes, these amounts will change. So let's fast forward. Let's say hypothetically, you have now retired from your job and you know that your future income is going to be significantly lower than what it was 2 years ago. Once you apply for Medicare and you get that letter from Social Security telling you what your Part B premium is going to be, if you know your current and your future income is going to be lower than what it was 2 years ago, you can actually call Social Security and ask for an income adjustment request. Now, you may have to do this multiple times because it depends on what happens with your income. But every year, you're going to get a letter from Social Security telling you what your future Part B premiums are going to be for the upcoming year. You look at that document. If the amount that they're using to calculate your Part B premium is concurrent with what your current income is, then fine. That's what you're going to be paying for the future 12 months. But if you know that your income as it stands today is lower than what it was from 2 years ago, then yes, you can ask for the adjustment. Modified is just AGI, your adjusted gross income. So basically, when they say modified or adjusted gross, what they mean is after all your deductions, after you do all those expenses and stuff that you do throughout the year, any tax savings that you have, whatever your bottom line number is, that's what they're looking at, along with your dividends or any extra money that you have coming in. So when can I sign up or switch coverage? There are several enrollment periods that happen throughout the year. The one we are currently in is called the annual enrollment period. That's this lovely column right here. This is the time frame, October 15th to December 7th, where Charlene does not sleep. I don't sleep. I drink a lot of coffee and talk to a lot of people to try to help them make changes within this short little window of time that we have. During this annual enrollment period, this is specific to people who are already in Medicare. So this does not apply to someone who's in a group plan and is looking to sign up with Medicare. They're in what they call a special enrollment period. So if you're coming from group insurance and you're thinking about retiring, or you're turning 65 and you're thinking about retiring, anyone that's in a group plan and is looking to leave from that group plan, they are going to fall into this lovely little bucket right here, the special enrollment period. So basically what happens is from the time that your employer coverage ends, you have a 8-month window of time to apply for Medicare A and or B. And you will not be penalized for delaying your enrollment into Medicare. So let's say you're 70 years old, you've decided, you know what, that's it, I'm going to retire, I'm done, I'm going to go ahead and sign up for Medicare. And, you go ahead and you apply for Medicare A and B. But now you're suddenly thinking, wait a minute, was I supposed to apply for Medicare A and B when I was 65? Well, you've been working at IEEE and there's more than 20 employees there. So no, you did not need to sign up with Medicare A and B when you turned 65, because when you work at a large employer and there's more than 20 employees, you can actually delay your enrollment into Medicare and not be penalized. So now let's get back to when we were 70 years old and we're about to retire. Now, you're about to retire, you go to apply for Medicare, you have an 8-month window of time to apply for Medicare and not be penalized. Another enrollment period we have is the initial enrollment period. That is a 7-month window of time. So the 3 months before, the month of your 65th birthday, and 3 months after. That is your 7-month window of time to go ahead and enroll in Medicare. Now, that typically applies to someone who's got individual coverage, or maybe no coverage at all, or maybe they're at an employer with less than 20 employees. They would be the ones that would be applying for Medicare when they turn 65. Next, you have the general enrollment period. This is for individuals. Let's say you leave your job and you have no coverage. You're just out there with no coverage for like 2 years. And now it's July and you pop up and you say, hey, you know what? I think I was supposed to sign up for Medicare and I didn't do it. Well, maybe I'll do it now. And it's like in the middle of the year. Well, you're not going to be able to apply for Medicare A and B because now you stopped working like 2-3 years ago. And now you have nothing. It's in the middle of the year. You are going to have to wait until January 1st to enroll into Medicare A and B. So that's the general enrollment period where they kind of give you a 3-month window of time to apply for Medicare A and B if you didn't do it at the time that you kind of should have. Next, we have the open enrollment period. This is for people who are already in a Medicare Advantage plan. That's my next crazy time, from January 1st to March 31st, when all of my Medicare Advantage people come to me and say, hey, Charlene, I didn't make a change during my annual enrollment period, but now I think I do want to make a change now. Those individuals have a window of time where they can make a one-time change, but it's only for people in a Medicare Advantage plan. And you can only make certain types of changes. Like you can go from a Medicare Advantage plan to original Medicare and a drug plan, and you can only make one plan change. You can change from one Medicare Advantage plan to another Medicare Advantage plan. But if you are a person who has, let's say, Medicare plus a medical supplement plan and a drug plan, and you made your changes during open enrollment, around this time right now, and now we're in January, and you said to me, hey, Charlene, I don't think I want this medical supplement plan. I think I want to go with Medicare Advantage instead. I would have to tell you, well, we're going to have to wait until October 15th because you kind of missed your window of time. So that January 1 to March 31st is specifically for people in a Medicare Advantage plan. So, changing from Marketplace to Medicare, sometimes I have people say to me, if I have Obamacare or ACA plan or individual coverage. Those individuals, if you have a Marketplace coverage and qualify for Medicare, or you're soon going to be turning 65, you should consider getting your health coverage through Medicare instead of Marketplace. Because once you're eligible for Medicare Part A, which is, remember, the hospital insurance, you no longer qualify for the savings, those subsidies that they give you on your marketplace plan premiums or your out-of-pocket cost. You will be paying full price for your marketplace plan. So if you have any friends or family members that are in a ACA, or some people refer to it as Obamacare, or the state insurance that comes from healthcare.gov website, if you're in that and you become eligible for Medicare, now your subsidies are gone. So now you're paying full price for your coverage. So it's going to be to your advantage when you turn 65 to then move over to Medicare and come away from Marketplace, because Marketplace is probably going to, skyrocket in price, and Medicare probably will be more financially cost effective for you. One little thing to note, marketplace coverage doesn't end automatically when Medicare starts. You have to update your marketplace application to end the marketplace coverage for those who are starting Medicare. You can report a Medicare start date on your application up to 3 months before Medicare starts. After you submit your application update, make sure you confirm with the plan. For the other people in your household, make sure if you're moving to Medicare, make sure the other people who might be on that marketplace plan, you want to make sure they have their coverage as well. So now we're going to touch on Medicare supplements versus Medicare Advantage. So here's your choices in Medicare world. So we start off with Medicare A and B. Everyone, regardless of whether you go with a supplement or a Medicare Advantage plan, step one is you have to have Medicare A and B. Once you have that solidified, now we have to decide, do we want to go with a Medicare supplement plan, or do we want to go with a Medicare Advantage plan? So option one is your Medicare supplement insurance. And what Medicare supplement insurance is, Medicare's primary, A and B. And then you have the supplement. The easiest way to remember is your Medicare supplement plan is supplementing the parts that Medicare is not covering. Then you have the Medicare Part D. Easiest way to remember, what is D? D is for drugs. So option number one, you'll have Medicare primary, medical supplement plan as your secondary insurance, and then you're going to have a Medicare drug plan separate from that. Your other option is to go with a Medicare Advantage plan. Now, Medicare Advantage plans, not that I really want to confuse everybody, but that's going to be Part C. So Part C takes A, B, and D and squishes it all together and calls it Medicare Advantage. So Medicare Advantage is basically taking your hospital coverage, outpatient services, your drug coverage, and bundling it all into one plan. It kind of looks like the coverage you have now as with your employer coverage, where you have one card that you go to the doctor. That's the same card you use as when you go to the pharmacy. So option one, medical supplement and a drug plan. Option two, Medicare Advantage. Both options require you to have Medicare A and B. So Medicare supplements. You are eligible if you are enrolled in Medicare A and B, you are a resident in the state in which you are applying for, and you're over 65. Now, there are some instances where you could be under 65 and have a Medicare supplement plan. I think the youngest you could be in some companies is 50. I actually have one company that does write it if you are under 50. So it really depends on what state you are in. If you're under 65, you can also get a medical supplement plan, but it's kind of restricted on which ones you can have. So when it comes to Medicare supplemental insurance, there's three enrollment eligibility types. You have open enrollment, guaranteed issue, and medical underwriting. Now, this part is really important because there's only 4 states out there that have no medical underwriting. New Jersey is not one of them. New York is a state that has no underwriting, but New Jersey definitely does have underwriting rules. So the first enrollment period is open enrollment. So basically what that means is within 6 months of the effective date of your Medicare Part B, You basically can enroll in any medical supplement plan with any insurance carrier, and they absolutely have to approve you. So there's no health questions. They are going to approve you. You're going to get the lowest rate that they offer. Next, you have what they call guaranteed issue. Now, what happens with guaranteed issue is that, let's say your employee, maybe let me see, how can I spin this off? The easiest way to explain this is, let's say hypothetically, IEEE had less than 20 employees and you were still on the group coverage. You had Medicare A and B, and maybe you've had it for like 5 years. So you've had A and B for 5 years. You've had your IEEE coverage. Now keep in mind, this is my scenario is under 20 employees. So now you're working, 70 years old. Now you say, you know what? I'm going to retire. So now you're like, okay, well, I'm well beyond the 6 months of my Medicare Part B effective date. Am I going to be allowed to get into a supplement plan? Yes, there are certain supplement plans that would allow you to enroll in what they call guaranteed issue, as long as you do it within 60 days of losing the, in this case, the IEEE group insurance coverage. So even though Part B started 5 years ago, you can still get into certain medical supplement plans with no health questions asked. You're guaranteed to get the lowest rate and you're guaranteed to be approved. The third option is medical underwriting. So let's say, fast forward, we've now retired, we had a medical supplement plan, we've had it for years, and suddenly you notice you get your renewal and oh my goodness, these premiums have skyrocketed. And you're like, oh, Charlene, my premium went up like $50. Are there any other carriers that can give me the same option at a lower price? And I'll say, I can look for you and see what we can find. But just one little caveat. If we change from this carrier and go to a different carrier, there's going to be medical underwriting. They are going to ask you health questions. And we're not going to be able to guarantee what your premium is going to be until that application is submitted with that carrier. They go through underwriting and then they come back to me and say, okay, this person is clear. They haven't had any recent inpatient hospitalizations. They've cleared medical underwriting. We will give them the lowest rate. Now, I don't see what the reason is as far as if they do medical underwriting and something pops up, they will contact you directly and tell you why the application maybe got a higher rate or maybe it was denied. So when you're looking at medical supplement plan options, it's really good to think about long term because a lot of times, several years from now, you may decide you want to go into a different supplement plan. But we just have to think of, yeah, we can make those changes. But if there's any health concerns or anything going on, it's a possibility that you could actually be paying a higher premium if we make a plan change. But, once a person is a client of mine, I talk about those things when, years from now when we're already in a plan. So, what is Medicare Part D? We talked about the Medicare Advantage plan. I talked about Medicare Part D a little bit, but now I'm going to dig in a little bit more. So, Medicare Advantage plans have the drug coverage already built into it. If you have a supplemental plan, the Medicare coverage is going to be sold by a private insurance company separately. So, Part D, this is kind of what it looks like. You have several stages when it comes to the drug coverage. Now, whether you're in a Medicare Advantage plan or you have a standalone drug plan, this still applies the same way. So your annual deductible is $590 in 2025. In 2026, this amount is $615. Now, every insurance carrier treats this deductible differently. There are some carriers that have no annual deductible on their drug plans, and then there are some that maybe it's 200, 300, but the highest it can be is whatever that threshold is for that year. And that threshold for 2025 is 590, and starting in January 2026, now that number I know for sure is 615. Now, Once you meet your deductible, you now go in what they call the initial coverage. This is basically your copays. To give you an example, let's say you go to the pharmacy and the medication, the retail cost of the medication at your CVS pharmacy is $1,000. You're going to be responsible, if it's 2025, you're going to be responsible for that first 590. So now you've gone to the pharmacy, you filled your prescription, you paid that 590. Now we're going into the pharmacy again the next month because now we need to get a refill. Now you're in the initial coverage. And let's say that same drug, $1,000, you're going to pay 25% of your prescription cost. So now you're not paying the 590, you're paying 25%, you're paying 250, right? So now you keep doing this. Once you hit $2,000, now you go into what they call the catastrophic coverage, which basically means when you hit $2,000, now you spent $2,000 out of your pocket. Once you hit that amount, your drugs are covered at 100% for the remainder of the year. Only covered drugs. So whatever if the doctor prescribes something and the carrier is not covering it, but you decide to get that prescription anyway, whatever you pay for that prescription would not fall into that 2000. It's only on the medications that the carrier is actually covering. So now your deductible in 2026 is 615. This $2,000 that I'm referring to, that's the 2025 number. In 2026, it's going to be 2100. All right, so what should I be doing and when should I be doing it? So you have employer coverage and you're turning 65. If you will not be automatically enrolled, you should sign up for Part A when you're first eligible. Your employer coverage would be primary and Medicare Part A would be secondary. However, if you have a health savings account, you should not sign up for Medicare A or B. The reason why is because you cannot be enrolled in Medicare and contribute to a health savings account. Once you know that you're going to be going on to Medicare, if you are contributing to a health savings account, you need to stop, and then you can enroll into Medicare. You can withdraw from your health savings account when you're enrolled in Medicare, but you cannot contribute to it. If you have employer coverage and you're over 65, if the employer has less than 20 employees, you should sign up with Medicare A and B when you're first eligible because Medicare Part A and B will be primary over the group insurance. If there's more than 20 employees, the group insurance is primary, Medicare is secondary. Drug costs reset themselves every year, every January. I'm just looking at a question that popped up. And the question was, and do the drug costs reset themselves the next year? Yes, they do. So every January is your reset button for pretty much everything with Medicare. Your deductibles, copays, coinsurance, everything. Reset button, January 1st. So the size of your employer group matters. There's less than 20 employees, you must enroll into Medicare because Medicare A and B will be primary, group insurance secondary. If there are more than 20 employees, you do not have to enroll into Medicare A and B. Your group insurance will be primary. You can continue business as usual. If there are less than 100 employees, but you or your spouse qualify for Medicare due to a disability, Medicare would be primary. Now, this is one of my favorite topics. And the reason why I say that, I mean that in a really good way. COBRA and Medicare. So this is not the most logical rule. Medicare and COBRA coordination is so important as far as the timing. So let's say you retire from your job, you're 64 years old, and you go on COBRA. You are fine being on COBRA, everything is going great. You turn 65 and you're like, you know what? I just want to stay with my group insurance. I don't want to go on Medicare. I have my COBRA coverage. Everything is wonderful. I'm paying my premium. Status as usual. Everything's great. No. So what happens is if you have COBRA first and then you become eligible for Medicare, COBRA is supposed to stop and you're supposed to go on Medicare. However, If you have Medicare Part A or Part B, and then you become eligible for COBRA, you actually can have both of them. I know that's a little strange, but it's all in the timing. So if you have Medicare A and B, or A or B first, and then you're eligible for COBRA, then yes, you can keep COBRA. But if you have COBRA first and then you become eligible for Medicare, COBRA stops, you have to go on to Medicare. One other piece to that is, again, going back to that first scenario, let's say you just have Medicare Part A only. Then you get COBRA. And you're like, all right, I'm going to just do COBRA, have my Medicare Part A, everything's going to be fine. Nope, it's not. You know why? Because the carrier for the COBRA coverage is going to say, hey, wait a minute. I can see that this person is Medicare eligible. I see they only have Part A, but they don't have Part B. Well, us, the COBRA carrier, we're going to pay the claims according to how we normally would pay it if you did have Part B. So we're only paying 20%. Medicare is supposed to be covering 80%. If you don't have your Medicare Part B in place, then we're still only going to pay 20%. You're going to be on the hook for that 80% that's missing. So if you have Medicare Part A, then you become eligible for COBRA. You have to get Part B in order to have full comprehensive coverage because A and B are going to be primary and your COBRA insurance carrier is going to be secondary. And the only way you're going to get that full coverage is if you have A and B. I've seen it time and time again. People will get Part A and they think, oh, I just have COBRA. It's fine. They'll pay everything. And they might for a couple of months until that carrier does an audit of their book of business and sees that there's individuals in their book that were supposed to have Medicare Part B. And then that carrier can come back and say, oh, wait a minute. We're not supposed to pay 100%. This person's Medicare eligible. Medicare is supposed to be paying their portion. We're only going to pay 20%. So now you're going to have some pushback and you might have a little bit of fight over whatever claims were submitted. So very important when we get the timing right with COBRA and Medicare. So possible late enrollment fees. Part B is 10% for every 12 months you didn't sign up. So let's say you decide, you know what, I don't feel like paying for any health insurance. I'm perfectly healthy. All is great with the world. I am not going to have any insurance. And then you wait 5 years. And then you say, uh-oh, wait a minute, something's wrong. I need to get Medicare Part B. So for the 5 years that you didn't have it, you're going to pay a 10% penalty for each year that you didn't sign up. And if you do have a penalty, the penalty is every month for the rest of your life going forward. Same thing with Part D. I have had clients come to me and say, I don't take any medication. Why am I paying for drug coverage? And I say, well, if you don't want to have the drug coverage, that's perfectly fine. It's totally your choice. However, I have to explain that if you do not obtain drug coverage at the time that you turn 65, if you have group insurance, you're perfectly fine. This is for individuals who are 65 and don't have anything. And maybe they sign up with Medicare. Maybe I help them with a medical supplement plan. So now they're good on the medical side, but they tell me, I don't want drug coverage because I'm not taking any drugs. If you decide, all right, I'm going to go 2, 3 years, no drug coverage, then the doctor pops up and says, hey, I need to prescribe Eliquis or Xarelto, something expensive. And you say, hey, Charlene, can you please sign me up with drug coverage? I'm going to say, sure, I can, no problem. During open enrollment, I can sign you up with a drug plan. And let's see, let's remember, like, let's think about this for a minute. How many years did you not have drug coverage? Let's say it was 5 years. You're going to pay a penalty for that time frame that you didn't have drug coverage, but you were supposed to. And guess what? That penalty is going to be calculated and it's going to be every month for the rest of your life once you do enroll into a drug plan. So let's say you get a drug plan and maybe the premium is $40, but you have a penalty of like $20. Now you're paying $60 every single month for the rest of your life because of the time frame you didn't have the drug coverage. So I always advise my clients that even if you're not taking any medications, still have drug coverage. What about my dependents that are on my company's coverage? Whenever a client comes to me and says, "Hey, I'm thinking about going on to Medicare," one of the key questions I ask is your plan covering anyone else, a spouse, children, anyone else? Because if you come off that employer plan, that's going to leave your dependents with no coverage because they only have the coverage because you're on the plan. So when we're doing an analysis of or thinking about possibly transitioning from group insurance to Medicare, I try to have a conversation to think about the entire picture, including the spouse and any dependents. All right. So how can a consultant help me with this transition? So, PTI Consulting Services, that's me, and my team works with multiple health insurance carriers, making it easy for us to match you with the plan that lines up best with what you're looking for, from benefits to budget, at all at no cost to you. So now I will give a caveat. What's happening right now is in 2026, I'd say, especially in New Jersey, out of the 12 plans that they have available for the drug plans, the carriers have made 11 of those plans non-commissionable to brokers. As it stands right now, what we do here at PTI Consulting Services, we're still assisting everyone the same way. It's just business as usual for right now. The carriers are cutting the commission. Yes, I'm also in New York. I'm in 36 states, by the way. Um, the carriers were basically forced to provide better prescription drug coverage for um, everyone out here, all the 65 plus. And as a result, they have increased their premiums quite a bit. Some as high as some of them have doubled or tripled in some states. And the carriers have then decided to say, okay, well, we have to provide better drug coverage for our members. We need to cut money from somewhere. So unfortunately, they decided to cut the commissions from brokers. But like I said, we're still helping right now, business as usual. We still are very unbiased. Um, I look at all the insurance companies, and right now in New Jersey, there's 12 plans available. I look at all 12. If there's a plan that is non-commissionable and that's the plan that's best suited for you, I will tell you that. I'll say, this is the plan that's best suited, but I also will let you know that it's not commissionable to a broker. And what that means is that there's no compensation to the broker. However, I do give you the tools that you need to enroll into that plan so that you still are getting the plan that's best for you. The only caveat is once you enroll into that plan, I myself can give just general advice. I can't go into great detail on the customer service aspect of it because I'm not attached to the application. So we will still assist you, give you all the tools you need to make sure you're getting the plan that's best suited for you. However, from there, we will be advising you on how to manage the plan throughout the year. So when should I start discussing Medicare? So the ideal time to reach out to me is, like 2 to 3 months before you're going to retire. That's an ideal time. And it's more so because we have to allow Social Security time to process your paperwork. Especially now since we're in a shutdown right now, the paperwork process is a little bit longer than usual because they're kind of working with a skeleton crew. But typically, if we weren't in a shutdown, I still would say 2 to 3 months because we still have to give Social Security time to process your paperwork. I can turn things around pretty quickly if need be, if we're on a time crunch, but we're kind of at the whim of Social Security as far as their processing, as far as like their timeline of when they do things. So 2 to 3 months is the ideal time. All right. This is me.